call me quick for this kit. Hey guys, Destiny Van here with you. I'm gonna tell you about this great treatment kit that I have that's gonna help you make sure your clients take their medicine like they're supposed to. It's gonna be wonderful and you're gonna want to purchase it today, guaranteed. Alright, so first things first, we got some activities here that are gonna be really good for hand strength. So as we all know, you gotta be able to grip and you gotta be able to use your hand when opening your pill bottles. So even though this may look unusual and like it's not supposed to go with medicine, why does she have a water hose nozzle? I'm gonna tell you. So what you can have your client to do is do some repetitions with this where they have to squeeze it. You can tell them how many reps to do depending on the client that you're working with. So if they have arthritis, the number of reps may be different than somebody that has Parkinson's. So it just depends on what you feel is necessary. But this can be used with anyone that has decreased hand strength. This is going to be good. This is necessary. Alright, so the second thing, we got another hand strengthening activity. So this right here is actually a clown nose. Isn't that cute? But because we're OTPs, we know how to use something for something else. So what you can do is have them to grab this, squeeze it as many times as you say, switch hands, do the same. It's up to you. But this is going to be really good. They can take this home with them. They can use it while they're doing other things. So this is going to be a great hand strengthening activity. So that's really good and that's necessary. Alright, so next thing. We got some index cards here. Index cards. Why do you need index cards for some medicine? I'm going to tell you why. Each card has a different question on it. So these are just some fact-finding questions that are really going to help you get to know your client, get to know their needs, get to know their impairments. This is going to help you know where your client stands. All right, so wonderful first question. Why is taking your medication important to you? So the first thing and one of the most fundamental aspects of occupational therapy is we are a client-centered profession. So what the client feels is important, we feel is important. So you may have a client that may not even understand why they're prescribed a medicine, so they might not find it important. It's up to you, now that you know they don't think it's important, to explain to them why it is. So these are going to be really good. All right, so another example. This question is going to be really helpful for letting you know if your patient may have memory issues, may have some confusion, it might be a little dementia there. So it says, please write down the days of the week. You got to know the days of the week to know how you got to take your medicine for the week. This is very important. So all of these questions are going to be really helpful. So this is a great tool for this kit. Alright, the next thing we got here, a dry erase board. Why does she need that, you say? I'm going to tell you why again. You can have your client write down the answers to the questions you're asking. You can write down something for them. You can draw up a schedule. You can use this dry erase board however you see fit during your treatment time. Also, this can help with them with their grasp as well. They can use, as we know, when you use a pen, you use a tripod grasp. So this can just, with writing, really help them with a variety of different grasps. So that's going to be good. All right, what do we have next? We have a journal / planner / scheduler, however you want to use it. All right, so just your average notebook. But what's so special for it to be in this kit, you ask? This can be given to your clients. It's only $1 at Dollar Tree. So you can actually take the time to show them how to track the medicines they're taking every day. So you can have them write down Monday, morning meds, Monday, afternoon meds, Monday, evening meds, Tuesday, same thing. However you want to use it, this is going to be great for them. So that's a wonderful addition to this great kit. Alright, so here's the fun stuff. Alright, we got some beads here. So for the sake of this video, these beads are going to simulate medicine. Isn't that neat? So we got some different color medicines. They're also different sizes. Alright, so what you can have your client to do is get a pill bottle, which we have some sample pill bottles here. I made up some labels. We're not violating HIPAA, guys, so don't worry about that. This just says John Doe, okay? So we're good there. So you're going to have them to read the label to you, which you got to know if they can read. That's necessary to understanding your medicine. You got to know if they even understand the directions. So once you get, an understanding of if they know what it means, then you can make this an activity. So for example, this bottle says ibuprofen, 600 milligram tablets. Take 1 tab by mouth 4 times daily if needed. So that's going to be a total of 120 pills. So you're going to have your client count out 120 pills, and you got to make sure you specify the color that the medicine is supposed to represent, because you don't want them putting all kind of different colored pills in there because they're supposed to represent different medications. So let's say I say the purple one is ibuprofen. So you're going to have them count out 120 pills, which is going to be really good for tip pinch. It's going to be good for purposeful grasp and release. It's going to be good for counting. That's going to work on that as well. And you can use this as an opportunity to let your client know that they don't have to get the type of cap that twists on and off. They can actually ask their pharmacy for what we call an easy to open snap cap. So what you do is they'll turn it up like this and you just pop it off. Doesn't take a whole lot of energy. It's not using a whole lot of those finger muscles, so it doesn't require as much fine motor control as twisting. So that's going to be a good tip that you want to let them know if they have arthritis or any type of muscular issues. That's something that you definitely could relate to your clients. Alright, so if you wanted to help your client actually sort their medicine, which this is important, this is so important, we have a pill organizer here. It's a 7-day pill organizer, and the neat thing about this, it has the different times of the day on here. Isn't that cool? So you got morning, noon, evening, bedtime. Alright, so let's say at this point they've put all their colored beads in each medicine bottle. We got that? Alright, so now we're going to have you push the button, pop it open. Alright, so now we're going to take our ibuprofen and we're going to put one of them in the morning slot because we're taking it 4 times a day. So that means we got to take it morning, noon, evening, and at bedtime. And we're going to just explain to them that you got to put one in each slot. And you're going to do the same with all their medicines. So this is really going to help them with their categorization skills. This is going to help them with sorting. This is going to help them with attention, because this does take some attention because you don't want to accidentally put the wrong medicine in the wrong time or date. So that does take some working memory, and all this is going to help with their procedural memory as well. Alrighty, thing we got here, if you have a client that may have some visual impairments, this is what we call a talking pill reminder. So what you would do, it has a button that says timer, and then it has a button that says audio, and both of these buttons do have Braille on them, so that's going to be really good. So you are going to press the audio button to record a message. So for example, I'll show you. Take lisinopril 300 milligram tablets. Take one by mouth every day. Boom, you got your message recorded. And then you can even set the timer for the interval that you need to be reminded. So if you want to do every 2 hours, if you want to do every 4 hours or 6 hours, this is going to be a great way to give them an auditory reminder. So that's going to be good. And actually, you can use this even for people who don't have visual impairments. Anybody could use this. I could use this. So that's going to be really multi-purpose, which is great. All right, so here, this is what we have for those clients who may have, once again, some visual problems. They might have trouble reading their labels. They may be too small, because sometimes it is written kind of small. So we got a magnifying sheet here that's going to help zoom those things in so they can see it, because you got to be able to read in order to know what you need to do. So this is definitely a key aspect of this kit. Last thing, guys, what we have here is a pill cutter. So this pill cutter is gonna assist those clients that may have swallowing issues. They can't swallow a whole pill. So what can I do? You can cut it in half. You don't even got to use a knife, which could be a safety hazard for some patients if, you know, have Parkinson's. They might have trouble staying steady. So this is great. All they have to do is place the pill in the red triangle, push it down with their palm if they have arthritis, if they don't have all that finger control, or if they have some pain in their hands. All you got to do is just use your palm and cut it right in half. No trouble at all. And you just want to make sure you show them how to properly and safely, more important, use this tool. Alright guys, so I think that's pretty much everything in this kit. Now, I don't even got to tell you, but I'm going to remind you, it's time to buy it. It's only $46.99, and it's so useful. It's going to be great. This is going to help us make sure we keep our clients healthy, make sure their well-being is wonderful, and also help us to help them. So thank you so much for your time, guys. Remember, call me quick, buy this kit. See you next time.